Hello, and welcome from Davos, Switzerland. My name is Madeleine Hillyer from the World Economic Forum. Thank you for joining us for today's press conference on achieving health equity by tackling trust gaps. I'm joined today by an excellent group of panelists to discuss health equity and the importance of building trust within marginalized and underrepresented communities. Here with us today we have Paul Hudson, CEO of Sanofi, Michelle Williams, Dean of the Faculty, Harvard T.H. Chan School of Public Health, and Caroline Casey, founder and director of the Valuable 500. Thank you all for being here with us today. Paul, I'll turn to you first. Sanofi has just launched its new A Million Conversations initiative. Can you tell us a bit more about that and what you hope to achieve?
Thank you. Well, look, first of all, I'm delighted to be here today, joined by such an esteemed panel. Thrilled that everybody could be here and to participate. You know, Sanofi has a noble purpose. We're a global healthcare organization, and we chase the miracles of science to improve people's lives. That's what we do. And every year, hundreds of millions of people rely on us, and we manufacture, ship medicines, we discover miracles, we do our best to play a part in helping for better health outcomes. That said, our contract with society and our mission as a company also puts us in a position where we try and understand what may prevent people getting equal access to healthcare. What could be stopping this? And sometimes it's things you don't expect, and sometimes it's things that we as a company have to step in and do something about. So we've decided to expand our focus on helping to rebuild trust with healthcare systems, in particular for minorities, in particular for women, for people with disability, for ethnic minorities, and for members that identify of the LGBTQ+ community. We know that there is a lack of trust, and we know that lack of trust can lead to a poor health outcome. This inequity is front of mind for us. This inequity, we have to do something about it. Now, what can we actually do? Well, the first thing we can do is declare an investment to do some good here, an important work. A Million Conversations will be backed by a €50 million investment over 8 years. That's a significant commitment, both of money and time. Important that we invest enough to make a difference. Important that we do it for long enough for it to become habit, if we can break the cycle and really help rebuild trust. The key programs, I guess, well, there's three. One is our Next Gen Scholars Program, which is really recruiting and accelerating amazing people from these groups that I've mentioned to participate in their journey, recruit them, develop them, support them, bring them from those communities so they can go on and create incredible environments for those that follow, and so that people can be what they can see, which is very important for us. Secondly, we're going to have hundreds of dialogues across the world, in principle though, UK, Japan, UK, Japan, Brazil, for example, the United States, where we think these disparities are alive and a problem in delivering the right healthcare outcomes. And we're going to create these conversations, and that may be hundreds, it may be thousands, it may indeed be even more than that in terms of the number of conversations we're going to trigger. Remember, the lost trust between a healthcare professional and somebody in a minority group often comes from a misunderstood conversation. So our job to try and correct that, to encourage a different outcome, becomes much more compelling. And lastly, we'll capture these stories, we'll capture these solutions and put them in our annual trust report, leading really to along the journey to 2030. Because you have to be determined, you have to be resilient, and you have to be committed for the long term. This program for us is not a poster by the elevator. This program for us is incredibly meaningful work that needs to be sustainable and make a difference to cross the trust gap. Lastly, and before I hand to our esteemed panelists, I think what's really interesting is data. Getting data, using data to help understand the differences. And for us, data is the key. It may only be a 10 or 20% gap on the trust between a minority group and somebody not from a minority group with a healthcare professional. That's a large gap for what it can do, and that's compounded when people say come from two communities of that. So we have work to do, and it's probably best at this point that I ask Michelle Williams, the Dean of Public Health from Harvard, to be able to share her thoughts on, how can we really understand this challenge, and then how can we, amplify our projects to make sure they have the maximum effect. So thank you to you, and over to you.
Thank you. I want to thank you all for being here, and I want to thank Paul and the Sanofi team for developing and really leaning into designing and investing in this very important program. Because really, the miracles of science we've seen in the creation of the COVID vaccines. But we had to really work to understand why vulnerable populations are hesitant about accessing them. And this issue about trust in the context of COVID is just one example where health disparities can only be addressed if we listen and learn and do what is necessary to address the trust gap. So what I'd like to do is to go through some of the very striking data points that's guiding the work to lead us to action that will get us closer to closing the gap in trust, and by doing so, close the health disparities gap that we know persists. Let me begin by showing you some of the data from the survey that Paul mentioned. 5 countries across 4 continents. And what we learned in this is that a majority of respondents, 54%, said that they had healthcare experiences that damaged their trust with their healthcare providers. And an even greater number of respondents, 60%, reported experiences in healthcare that damaged their trust in the systems. In every country, all 5 of these countries, marginalized groups, minority groups, were more likely than their non-minority counterparts to express and report even higher levels of reports of damage in their interaction with healthcare that attenuated their trust in the institutions and the providers, respectively. What does that mean? I mean, for the overall, we're talking about an almost universal, right? 65%, almost universal lack of trust. So we've got to pay attention, and I think that's really important. Pay attention and motivate action. I want to also express a very fascinating point about this survey. 4 different continents, 5 different countries, vastly different healthcare systems and cultures, and yet minorities across all of these countries, across all of these geographies, shared a lack of trust in their various organizations, and in particularly the providers that work in these organizations. If you indulge, I'm an epidemiologist and I have to speak also in numbers. So what I'd like to do is share with you some more information from the surveys, what we are learning. We're learning that 68% of respondents with disabilities, 64% of ethnic minorities, 64% of people who responded to gender as other, and 60% of women reported that they had experiences that damaged their trust in their providers. Similarly, when the question was asked around health systems, the level of the trust gap increased. In all cases across all of the demographics that I just shared, gender, ethnic minority, disability status, and LGBTQ, at least 72% of these populations, respectively, reported a lack of trust or defrayed trust in institutions. There's more, and I really want to let me indulge in 2 more statistics that I want to share with you. The survey was designed in a way where we could also analyze and understand intersectionality. intersectionality being individuals who have or represent more than two of the characteristics that put them in a minority status. And when you look at that data, you realize that there's even more profound mistrust in populations that would need to access health care even more assertively to maintain or prevent illness. So let me give you an example. 22-point gap between people who come from ethnic minority groups and identify themselves as LGBTQ, those compared to those without those backgrounds. That's a 22% gap. Now, another example, a 30-point trust gap between those who come from ethnic minority group and have a disability, and compared to those without those backgrounds. So why is this troubling? Why do we see such disparities in trust, such big gaps? Because, and why is it important? It's important because trust, as Paul said, is an essential part of the relationship with patients and healthcare systems if they are to be effective in promoting, protecting, and preserving health. When people don't trust their healthcare systems and their providers, they will avoid preventive checkups. They will avoid early interactions for early diagnosis and treatment. And most importantly, it's even tougher to maintain trust for public health officials who are often asking people to breaking through and asking them to change behaviors. And we've seen this in the context of COVID. So clearly, healthcare systems are in urgent need of reform, and we have to figure out where to start. And what is exciting about this endeavor, this initiative, is no matter what the group or what the respondent, the individuals in this survey have given us some ideas already of where to start. And I'll share them with you. 4, the respondents endorse being more thoughtful and providing reliable and dependable care, treating patients fairly, explaining everything in plain language that is understood, and making sure high-quality care is available and accessible. Now, the respondents across all demographics, 77 to 79% of the respondents, I say near universal, endorsed these as activities that we could begin to work on to engender trust in providers and healthcare systems. Now, what does that mean in practical, pragmatic terms? There are 3 points I want to bring forward. First, we have to diversify our healthcare workforce. We must increase the diversity of the workforce across the entire spectrum, and that would include the researchers who create those miracles of science, the healthcare providers themselves, nurses, doctors, and also the technicians who are delivering care. Schools and universities, research programs and hospitals, healthcare organizations all need to make a commitment to diversify if they want to have meaningful progress in closing the trust gap. And as always, in all complex problems that we work to solve, we have to commit ourselves to partnering to make this great challenge tractable. Second, we must devote more resources to keeping people healthy. That means that we have to work in communities, with communities, to address the drivers of health, the things that preoccupy many of us in our living days. And that would include being sure that we are in the community and we are listening, which is crucial. We have to train providers, researchers, and all in the health sciences and healthcare systems to recognize and overcome unconscious bias, to communicate clearly and with empathy, and also listen, and listen really intentionally. Respondents in this survey, time and again, told us that the most important reason why they have lost trust in the providers and the system is that they have not been listened to. Okay, there's another thing that we have to do, though, and that is to turn the listening into committed action. And I have to tell you that I am really excited about the conversations that is at the heart of Sanofi's new initiative, A Million Conversations, or AMC for short. I'm really looking forward to working with the team that's leading this project. Colleagues and I at Harvard are going to participate as a scientific advisory committee members. We will help shape the analysis in ways that will allow us to really evaluate the impact of this initiative, and maybe even contribute to designing additional polling to determine whether or not the efforts are really moving the needle on trust. So we will focus on performance and accountability, which is critically important, and it would be data-driven and transparent. I also am excited about what Paul mentioned, because this really illustrates the deep commitment to this project, and that is making sure that we add an educational component for the next generation. And I'm really excited about that, because one of the things that we have to do is improve our health science communications writ large. And this is a very strong and powerful way to begin that, and to engage young people, students, is critical. So I want to say that if we're going to close the gap in health disparities, we have to have conversations, we have to learn what's important in those communities, and that will be the bedrock for building trust. And I have to say, in healthcare and in public health systems writ large, because we all know that there has been growing trust deficits in global public health agencies as well as local ones. So the efforts to work on listening, the efforts to cultivate and curate conversations will be work that is critical for us to close the gap. And I will also say, extend the level of resiliency of our communities and populations to the crises that we know are shocks to our environmental and health systems. Thank you.
Thank you. Caroline, I believe we just heard Michelle say that 68% of people with disabilities don't trust healthcare. As someone whose organization is very dedicated to expanding inclusion for people living with disabilities, I'd like to hear from you more about what that number means in reality. Can you share with us a bit about that?
I will. And look, I'm the troublemaker of the group here, so I'm just going to start. I actually have a lived experience of disability myself. I'm registered blind. So for anybody watching online, I'm just going to do a bit of audio description. I'm a blonde, white woman from Ireland wearing a very ludicrously green top with a black sort of sweatshirt. I'm always fascinated by the idea of minority groups, and I know you say you're a numbers geek and you love them, and that's what I love, is when we start now having evidence of the numbers against really emotive conversations. Disability is 1.3 billion people in the world currently today, and that's really conservative. Yeah. 80% of that is invisible, so it comes really into this whole issue of trust. I loved what you were talking about intersectionality, because I stand here, I intersect 3 times. I'm a woman, I'm 51, so I'm old, I believe, and I have a disability. But the reason that this program interested me, it's because it is coming to it from a very universal view of human experience, not pitting one part of humanity against each other and having a hierarchy of minority groups or inclusion and exclusion. But I have to speak to you through the lens that I understand and I know and I advocate for, which is disability. But it does not mean that I choose it over anything else. There was an article in the New York Times on the 19th of October 2022. And it is quite a frightening article. And that article said that doctors would choose not to work with disabled patients if they had a choice. And there was another line in that article that said actually disability sort of clogs up the clinical flow. And this article was done on research with doctors and practitioners in an anonymous way. so that they could get the truth. I mean, we have to have these uncomfortable conversations. And this is about the fact that our practices may not be accessible, that the disability experience is having substandard, there's difficult conversations about understanding it, and also lack of respect. Let's just think back to the pandemic. We know in several of our countries, the clause of do not resuscitate if over a particular age or if you have a disability. So trust. Well, why would you trust? So if anybody's sitting here thinking this initiative is a really good initiative and it's looking good for the corporate stuff, it is a really strong initiative because it's actually holding something very dear in all of us, the trust that we have to put our lives in the hand of people. Are we heard? Heard. Not just listened to, are we really heard? The worst thing is the assumptions people make about who you are, your skin color, because you have a disability, because you're visually impaired, because you have autism. No, we need to hear. And why I'm sitting here, aside from sitting on the Sanofi Diversity and Inclusion Council, which has an intersectional approach, is because, number one, I am a collaboration wonk. You're a numbers wonk, I'm a collaboration wonk. You know, and we are in the decade of radical collaboration. The problems that we all face are so vast, okay, that we need to have collaboration, multi-stakeholder, multi-community, multi-organizations. I'm the founder of the Valuable 500, which is the world's biggest global partnership on business and disability, working together to end disability exclusion. It was launched in Davos on the main stage 4 years ago, and everybody said it was inconceivable. We've achieved it. We achieved it in 2 years and 2 months, and that's the biggest coalition after UN Global Compact, and they do work. And they work because of safety in numbers, and they work because they build trust, and they work because people can fail and try again. That's why I love this, and I think Sanofi's very brave, because honestly, I can imagine there'll be people throwing their eyes to heaven going, well, who do they think they are? Come on, we know that's true. But actually, it does need organisations and individuals often to start it. And that is one of the reasons I'm sitting here. The second is this trust issue on disability. I'm so glad that you have us at the table. Thank you for having us at the table and making sure everybody's represented. And that trust is real. But how do we stop or change that trust? Well, I certainly don't want to see the same faces in the same places as before. Did we not promise each other that after the pandemic? You know? So thankfully, we're looking at those new faces in the places that we need to see, different faces than the faces before in the next generation. And Gen Z are going to make sure that that absolutely happens for sure. The intersectional approach about this is incredibly important, but it is data. Data, data, data. The global report done by the World Health Organization on health equity for persons with disabilities proves exactly everything that Michelle has said, but they don't know why. So we need the data, yeah? We need real data, and we need standardized and harmonized data so we can do something with it. It's why we're here again as the Valuable 500, because we're looking to get our Valuable 500 companies to fill the data gaps, the shocking disability data gaps in business. We need data, and that can be both anecdotal and the heart side and the stories, but it needs to be matched with really strong empirical evidence and combining the moral reason that we are here, because it is about lives, all of our lives, really backed up with a strong evidence for it. You can't turn your head away, and nobody can. So I just want to say, you can hear this is a passion point for me, but I do think we each have responsibility for this, and I do really recognise Sanofi for standing up, because you're going to get criticised for standing up and being the start. I recognise the 50 million you're putting in and the long journey, because it's going to be a long journey, and I'm really proud to be sitting beside you, Michelle. So yeah, thank you,
Caroline. Caroline made a really important point, and if you think about what this project represents, it represents listening, hearing, learning, designing, testing, learning some more, and really taking this iterative learning process to scale. And that's why I'm here, because I think it really is an audacious.
I mean, it is, and it's
an
okay
audacious
to get it wrong,
approach.
right? You know?
Well, that's why the testing is in there, because
Yeah.
it will then use the evidence and the stories to course correct. That's what the scientific principle. That's what we do. And to bring that science into the other miracles of the biological science is exactly what we need to make sure that when we have the tools, the procedures, the protocols to help people thrive, that all people will feel comfortable taking advantage of that technology, tools, protocols, anything that will help anybody thrive and reach their human maximum potential.
We're running out of time a bit, but if there's any questions from the room, I can probably take one. If not, I think I'll turn back to our panelists. And for everyone in the room and watching on live stream, can you close us out with, one final thought or one step that people can take to rebuild this trust and improve health equity?
Well, for us at Sanofi, we're committed. You can see it. We're committed for a long period of time because we think it'll take it, at least to get us started. We're committed financially because we think nobody's doing the right level of investment to try and rebuild trust. We're working with the best people possible. I think people have seen today just how passionate but how objective we intend to be in the progress that we want to make, and how we will we'll make mistakes. I think you said it, Colin, but it's okay as long as we make progress. And my last comment would be, whilst I think we are brave to take it on, but I think we have no choice. We're open. If others want to collaborate with us, if other companies want to jump in, and expand the number of conversations that can be had, scholarships that can be earned, and add to the evidence and add to the progress, call us, reach out to us. We're just getting it started. And if you want to make it even bigger, let's do it. Otherwise, we'll keep moving until we make some progress.
I think Paul said it, but I'm going to just say a pragmatic, practical thing we can all do now. When we think of our own families and our own health, which is our most precious asset, think about those who don't have the access or the belief and trust and faith in the organizations that are designed to protect, preserve, and promote the health of everyone. And if we think about that and bring that forward in everything that we all do across all of our sectors, we will motivate the kind of positive change that Caroline is talking about.
I'm really tired of these holding patterns of hope that we keep going into, and I just want to see accountable action. But I think it's not just up to the Sanofis and the Harvards and the World Economic Forums. I think it's personal to each and every one of us to use our voice and our lived experience to question. And before we scoff and we criticize, just to ask what part that we can work towards. I didn't get to sleep until very late last night. My mother had an experience in the surgery with her GP. She's the mother of 2 blind daughters, registered blind daughters, and she has macular degeneration. And the GP told her yesterday, "Have you driven your car here?" And she said, "No, I got the bus." She said, "Just as well, because you're now illegal. You're illegally driving a car." That is not true. It's just an uninformed GP. But I have to say, that is a very tiny, minor example of how trust is taken away because we're not taught properly how to be human in our approach. And it's from a very privileged position in Ireland. And I just want to say it's personal to all of us. So use your voice, use your story, and be counted in.
Thank you.
Thank you 3 for joining us today for this incredibly important discussion and a conversation to keep having, certainly. Thank you to everyone in the room and those watching on live stream. We're glad you were able to join us today as well.
Thank you.
Thank you.
Thank you.